So yeah, so the other three options obviously are associated with shorter telomeres, sorry, shorter telomeres, and omega-3 fatty acids are the opposite. Good job, guys. Okay, I can't say the distribution, but the answer here is red meat consumption. So high soy protein intake, cruciferous vegetables, and a low-fat diet, all three of them have shown to lower the risk of breast cancer recurrence. Nothing much to explain here, but yeah, so red meat consumption is not good for that. So there is an association between diet quality and adolescent depression. So that's true. So better diet has been shown to improve depression in adolescents. Yeah. Yep, so pretty close. It's 19%, so around 20%. And usually we don't need you to remember statistics, but there are some that can come up in the exam, and this might be one of them. So just remember that 20% of students believe that they haven't been well trained, that they had been well trained in nutrition counseling. Yep. Yep, so I think everyone got this one right, but yeah, so higher education has been associated with better metabolic health so it's not males, it's females, it's a lower BMI, and it's not the elderly. Yep. Yep, so mindful eating, it helps with all four of these things. So it helps with digestion, improves food choices, increases satisfaction, and also reduces unnecessary food intake. So yeah, all of them were the right answer there. So most of you got it there. Processed meats, they are classified as a group 1 carcinogen. So that is true.
Yep, good job. So selective toxicity is making sure you want to target the cancer cells, but not have that impact on the healthy cells in the body. So good job. Yep, so this is just an explanation, which would be in our slides for week 8. So just that the importance is to reduce that impact on normal cells. Yep, so the explanation will be in the next slide. Yeah, so basically, cancer cells aren't able to differentiate properly because they're proliferating constantly. So that helps with targeted therapy as well. Okay, so explanation on the next slide again. So there are different types of cytotoxic agents, which are listed here. I think there's another, yeah, and so here are the functions. So, so the apoptosis, the answer to that question was the alkylating agents. Yeah, and this is also in our slide as well, if you want to go revise this. Right, so these are some of the actions of those drugs. So there's the inhibition of the protein kinases, the mitotic spindles, and antigen expression, changing antigen expression as well. And this makes those cancer cells more detectable, and so they can be eliminated. Yep, perfect. So all of these are consequences of taking anti-cancer drugs. Yep, so this is just a list of other side effects as well. And some of the side effects you can treat with other drugs, such as vomiting. Yeah. Yep, so all of them are correct again. So cystitis is just inflammation of the bladder. Yep, so here's just another slide on that, and just splits it up into the different organs and systems as well. Next question. Yeah, so everything else would be used. So taking a drug holiday, what that basically is just stopping taking those drugs, and this allows for recovery from the toxic effects of those drugs. And using a single drug at a time can lead to resistance as well. Yeah. Yep, so this is just a slide going through each of the ways of reducing complications, so drug holidays, using radiotherapy or surgery, such as where drugs can't, like when they can't pass the blood-brain barrier, this might be the only viable option. Yeah, next slide. Next question, sorry.
Right, this is my question. Yeah, really well done. So that all you got it correct. So basically, health inequity is basically kind of unfair and avoidable differences in health outcome, and genetic factors are not avoidable, and all other three options are basically avoidable differences. Yep, again, pretty straightforward. So the scenario says the patient wants to receive termination of pregnancy, but the clinic doesn't offer it. So that's more about availability and acceptability. It will be acceptability if it says the patient, I think acceptability is, so it's more about the patient and the community that's receiving the healthcare. So if, say, in the community, there is a lot of objection against termination of pregnancy, or the patient themselves don't want to receive this procedure, that will be more about acceptability. Yep, really well done. So if you look at all the steps, they actually, some of them look quite similar, but it's great that you all know it. So yeah, basically availability, accessibility, acceptability, and like contact coverage. Well done.
Yep, so everyone got that question right, so we move on.
Yep, so that one was my question. Sorry, one. Yep, so if you go to the next slide, please. Yeah, so something poisonous is when you consume the toxic substance. So for example, mushrooms. And something venomous is injected into you. So for example, snake venom. So which is the immediate best step for a snake bite? Yeah, so you shouldn't apply ice or suck the venom out. And it's also not recommended to raise the affected area above the heart, just because then like the venom could be more likely to move. So rather just apply pressure and immobilize whatever body part has been bitten. So should you tie a tourniquet on a snake bite? Okay, so you actually shouldn't tie a tourniquet on a snake bite. You should just bandage it tightly, applying pressure. Which receptors are affected by postsynaptic neurotoxins? Yeah, so it'll be affecting nicotinic receptors because those are the receptors on skeletal muscle. So which of the following is true of myotoxins? Yeah, so myotoxins actually break down the skeletal muscle directly. The type of toxin that prevents neurotransmitters from binding to receptors is a postsynaptic neurotoxin. And then the ones that prevent release of neurotransmitters are presynaptic neurotoxins, and none of them break down smooth muscle directly. So here we've just got the 3 types of neurotoxin and the way that they act on the neuromuscular junctions. So the first one is presynaptic neurotoxins. These are the slowest ones. And as I mentioned, they stop the release of neurotransmitters. The second is postsynaptic neurotoxins, which are a bit faster, and they act as an antagonist on the nicotinic receptors on skeletal muscle. And the last one is myotoxins. So rather than acting on the neuromuscular junction, they'll break down the muscle tissue itself. What is the first line? Myasthenia gravis.
Yep, good job. It is pyridostigmine. And I am afraid to give any more information on that in case it comes up in a later question. So let's move on. Oh, wow, okay. Yep, good job to those 2 people. Yes, rocuronium is a non-depolarizing blocker drug. What else did I have about it? So it is a competitive antagonist of the nicotinic receptor. It's extra information. So good job if you got that. Excellent job. So yep, succinylcholine is a depolarizing blocker that is a nicotine agonist. It mostly acts at the neuromuscular junction, causing rapid, reliable start of muscle relaxation. And just to summarize so pyridostigmine didn't pop up in another question. So pyridostigmine is just a non-depolarizing blocker that it blocks the synthesis of acetylcholinesterase. And the action of pyridostigmine can be overcome by increasing the concentration of acetylcholine. And yes, it is the first-line treatment for myasthenia gravis. And I think that draws us to a conclusion with a full stop. Oh, not quite. Yep, the winner is Chen. Good job. Excellent.